Have you ever wondered why some people get better and some people don't? And are there barriers to healing, maybe some by the patient and some by the doctor? Well, this is a video that answers those questions. Hello everyone, I'm Dr. Jason West with a topic that's near and dear to my heart because I see this every day, and that is the barriers to healing. Why do some people get better with different treatments, and why do some people struggle or stay the same? And when I first started practice, I thought everyone wanted to get better, and so I have 3 stories that I tell people that illustrate the point. The first story is, I had a lady come into my office in 2005 that had a severe case of rheumatoid arthritis. You've seen her all over our patient testimonials, and she investigated some of the recommended medical treatments and did not like the side effects of the DMARDs and the immunomodulator therapy, and so she came to the office and she said, "Dr. West, how can you help me?" We did a series of toxin eliminations, an inflammation elimination program, vitamin infusions, regenerative injection therapy, and we treated her every Tuesday for about 2 years. Now, last year she snow skied like 52 times around the St. George Marathon, and the moral of the story is that if you treat people long enough with good stuff, everybody gets better. That's what I thought for a while. That's not exactly what happens, but her story made me think of that. And I had another patient come to the office from New Jersey that had a case of autoimmune MS. It was a severe case, and I thought in my head, if I treat her with these vitamin infusions for an extended time period, I'll really believe that I can help her. And what happened is that we treated her roughly 3 times a week for a year, and at the end of the year, I guess we could say that it was good that she didn't have any regression or worse, but she wasn't any better. She was disappointed and frustrated, and I was disappointed. And the moral of that story is that sometimes there's so much organic damage from a disease that you can't turn people around, and you don't want to overtreat people. So if you're providing a therapy that's not getting good clinical outcomes, stop doing the therapy. Now, just when I thought you want to treat people forever and that you do not want to overtreat people, so the opposite ends of the spectrum, I had a patient come out from Florida and she thought she was going to die, and her name was Amanda. You can see her on the daily dose vitamin H. It's the story of wheelchair to walking. Now, what was neat about Amanda's story was that as we started providing treatments for Amanda, I did not think that she was getting better, and I didn't want to overtreat her. And so I walked in the room one day and I was thinking in my head, it's time for you to go back home. And she said to me, "Dr. West, I want to show you something." She got up out of her wheelchair and she started walking. She took a couple steps and sat down, and she turned to me and said, "I've not been able to do that for years. The treatments are working. Thank you so much for not giving up on me." And the story of that is you can't take away patients' hope. So you treat people forever. Some people get better. Some people you plateau or don't get better. You don't want to overtreat them. And out of all these experiences, I've learned that there's actually 5 barriers to healing. Now, the first barrier to healing and why people are not getting better from a healthcare condition is they've had the wrong treatments and the wrong doctors. So sometimes you're just doing the wrong thing, or the medical community or the alternative medicine community is doing the wrong thing, and we're not getting very good outcomes. And I think this is so important, if you have a healthcare condition, to research your health condition and know all of your options and find the doctor that's right for you. And how do you know if you have the right doctor? You're getting better clinical outcomes than what you were doing before. Now, the second reason why people do not get any better is because they don't want to get better. Now, this seems counterintuitive and really unusual, and I did not think that this was happening when I first started taking care of people. But sometimes what happens with people is they have a disease, or they become the identity of the disease, and they just don't want to get better. Now, sometimes it's unconsciously, sometimes it's consciously, and a lot of times people will say, well, I could have been the first chair in the symphony or a senator or the president of the United States, but because I have a chronic debilitating disease, I can't do that. And they like the attention. They're actually enabled by their inner circle, a lot of times unconsciously, and sometimes what happens is they have a relationship where they really feed off that. And this is really difficult, not only for a healthcare provider to take care of, but also for the patient and for patient's inner circle, which leads us to the third barrier to healing. That's the inner circle. If a patient investigates a therapy that they want to do, or they like a doctor, or what happens is they get really educated on a condition or a symptom, and they want to do something else, and sometimes either the inner circle gives up, they're exasperated, or they have a different opinion set than what the patient has, And you don't necessarily have to have the inner circle agree with the therapies, but the patients, when they're doing things that are helping, or if they want to try something, sometimes the obstacle they're healing is either ignorance or lack of information, or sometimes it's just that the inner circle doesn't want the patient to have those treatments, and so that's a barrier. The fourth reason, or the other reason why people do not get better, is because they run out of financial resources. In America, we have a great crisis care interventions where if you have a heart attack or car accident or a broken bone, this is the best thing in the world for that type of medicine. But if you're in the chronic disease category, which is about 70% of healthcare conditions, what happens is we try to treat everybody like they have an emergency. We don't get the outcomes, or sometimes we'll say, look, you're a round peg that we're trying to put into a square hole, and they don't get the right type of treatments because it's not cookbook medicine. And so financially, it's really expensive to go through all different doctors, an insurance program, or cash pay system until the finances are exhausted, and it's a big problem. I really think that if people have the financial resources for the healthcare condition, for the most part, they can get over it. A lack of financial resources prevents a lot of healing. Now, that's just common sense, but the fifth reason is we have the wrong doctors, wrong treatments. Sometimes we have patients that don't want to get better, either consciously or unconsciously, inner circle and financial barriers. And the reason why some people don't get better is for a combination of all those things. So when we talk about barriers to healing, you got to know all your options. You got to research your doctors. You need to educate yourself and make sure your inner circle is educated and helping you with all the different options so that they can support you in your treatment options. They didn't always have to believe in the treatment as long as they're not a barrier. And then all of these different mechanisms, know what your options are. Know what the medical treatments are, know what the alternative medical treatments are, the nutritional consideration, the herbal options, acupuncture, massage therapy, manual therapy, and all of these put together. I have found that when patients have really good information, or at least they know all their options, they make the right clinical decision for themselves. Unfortunately, our system is set up where we subsidize or we pay for a drugs and surgery approach, and sometimes that's the only option people are aware of, and it limits their healthcare and their healthcare options. So the purpose of the video is to just help people to understand getting your education on your healthcare condition. I mean, I've learned a lot in school, but I've learned even more in talking to people knee to knee for the last 20 years, recognizing that there's some barriers of wrong treatments, wrong doctors. Sometimes we just don't have all of the information. Inner circle barriers where people are not quite giving the support that they could because they're educated or they're frustrated. Sometimes people don't want to get better. And sometimes what happens is when you get everything lined up, you get amazing clinical outcomes. We just wanted people to be aware that there's some barriers to healing, and it's just not always the right prescription. It could be the lack of vitamins, the lack of minerals, the lack of treatment options. That's one of the reasons why we developed the library, the West Clinic Library, that's available through the links. If you aren't aware of the West Clinic Library, please send us an email at info@westcliniconline.com. The purpose of the video is to give people ideas of barriers to getting better and some of the things that we can do to help that you have the education you need so that you can beat your disease. You're not your diagnosis. This is Dr. Jason West. I'll see you guys on the next informational video.